Hi everyone. Today we are going to talk about 5 commonly used medicines that can affect your kidneys if they are misused. But first, one simple thing you need to understand is your kidneys filter your blood and remove waste from your body. So, medicines can affect the kidneys by reducing kidney blood flow, directly injuring kidney cells, or causing excessive fluid loss. So, let's see which medicines we are talking about. The first is NSAIDs, that is painkillers like ibuprofen, diclofenac, naproxen, and ketorolac. What are painkillers? NSAIDs used for? These are used for headaches, toothaches, muscle and joint pains, arthritis, fever, and inflammation. And how do these drugs affect the kidneys? Kidneys normally need blood flow to work properly. NSAIDs decrease prostaglandins. Prostaglandins normally maintain blood flow to the kidneys. Okay, let's see how are these affecting kidneys. So, NSAIDs decrease a substance called prostaglandins. These prostaglandins normally help blood flow to the kidneys. Kidneys need good blood flow to work properly. That is how they use blood as a medium. They filter the blood. So, when the prostaglandins are decreased because of the NSAIDs, this leads to constriction of afferent arteriole. That is, the artery that carries the blood is being constricted. So, constriction of this leads to decreased flow to the kidneys. That is, decreased flow further leads to decrease in the filtration of the kidney. So, the risk is higher with high doses, prolonged use, dehydration, or pre existing kidney problems. The kidneys receive a very large amount of blood every minute, so changes in blood flow can matter a lot. So, I would say is don't regularly self medicate with painkillers. And here we go with the next drug, that is aminoglycosides. Aminoglycosides, what are these? These are antibiotics. These are most powerful antibiotics used for certain serious bacterial infections, especially when doctors need coverage against difficult to treat bacteria. So, and these are also called as strong hospital antibiotics because they can be very useful against serious infections. And these dosing should be monitored, and doctors always monitor aminoglycoside dosings. How do aminoglycosides affect a kidney? They accumulate in the kidney tubules. Thus, accumulation of aminoglycoside in the tubules leads to tubular cells injury. Aminoglycoside is a drug. This drug accumulation in the tubules lead to cell injury, and this cell injury further leads to decrease in the kidney function. That's why doctors may monitor kidney function during treatment, especially when therapy is prolonged or patient has other risk factors. So we should use exactly the prescribed amount of aminoglycoside. Next, we go to ACE inhibitors. ACE inhibitors, that is, they are also called as ARBs. These are drugs like enalapril, ramipril, losartan, and olmesartan. What are these? These are drugs used for high blood pressure, heart failure, and in selected patients they can help protect the kidneys, particularly when certain conditions such as diabetes are present. Now, how does this antihypertensive drugs affect the kidney? Antihypertensive drugs like ACE, ARBs, how do they affect kidneys? That is, they affect by dilating the arteriole. All we know is ARBs dilate the arteriole, and thus the pressure inside the glomerulars is decreased. This decreased pressure leads to decreased glomerular filtration rate. You see that? A small increase in creatinine can also occur after starting treatment. which is why doctors may monitor creatinine and potassium in these cases. And fun fact about this is, a medicine can cause a change in kidney blood test without necessarily meaning that the medicine is destroying the kidneys. So never stop your BP medicine on your own just because you heard it can affect the kidneys. And the next drug is diuretics. We know diuretics such as furosemide, hydrochlorothiazide. What are they used for? They help the body remove extra salt and water in the form of urine. They can be used in various conditions like high blood pressure, swelling, edema, heart failure, fluid overload. Whenever there is accumulation of unnecessary fluid in the body, doctors prescribe diuretics. In the form of edema, swelling, heart failure, in this form, they prescribe diuretics. How do diuretics affect kidneys? Let's see. Diuretics remove salt and water in the form of urine. This leads to excessive fluid loss. Excessive fluid loss sometimes may lead to dehydration. Dehydration can lead to decrease in the kidney blood flow. This further leads to kidney injury. So you should always take doctor's advice while consuming these. And the fifth one and our final drug is the triple whammy. Why is it called a triple whammy? Because it is a combination of 3 drugs. What are the 3 drugs? NSAIDs, AC inhibitors, that is ARBs, and diuretics, whatever with read above except aminobutyric acids. NSAIDs, ARBs, and diuretics. These 3 together is called as triple whammy. Triple whammy. So what does an NSAIDs do? We have learned that decrease in blood flow enter in the kidneys. They decrease the blood flow to the kidneys. And we have learned ARBs. These decrease the pressure inside the kidney filters. And we have learned that diuretics decrease the blood volume. So all this together can affect significantly reducing kidney filtration and increase the risk of acute kidney injury. And why is it called a triple whammy? Because these different drug effects can combine to put extra stress on kidney filtration. So if you take multiple medications, always tell your doctor, a pharmacist, everything you're taking, including over-the-counter painkillers. Understand? So finally what I say is, not every medicine that affects kidney function is a bad medicine. The real problem can be misuse, incorrect dosing, drug combinations, dehydration, existing kidney problems. An important rule is never stop the prescribed medicine on your own. As a PharmD, these are all the patient counseling points you need to consider. Don't self-medicate for long periods. Drink enough fluids unless restricted by your doctor. Never stop prescribed medicines on your own. If you have diabetes, BP, kidney disease, get regular kidney function. So guys, if you found this explanation useful, follow PharmD Girl for more simple and practical medicine information. And comment below what medicine should I explain next. Thank you.